everyone, it's Dr. Rhemtulla from Centennial Smiles Dental. Today I want to talk to you specifically about dental crowns and when they're used, why they're used, what's the purpose, what's the benefit. So these are all questions that I get from my patients on a regular basis, and I wanted to share that with you today. So what is a crown exactly? A crown is, you probably have heard the word cap before as well. So those are synonymous. So if this is your tooth, a crown or a cap just covers the entire surface of your tooth with a strong material that will help to prevent it from breaking and fracturing. Now, the reasons I would recommend a crown is, for example, if you had a really large filling on the tooth, like in this picture right here, you can see those silver fillings are really large. It's taking up more than 3/4 of the tooth. That essentially weakens the integrity of the tooth. And in a scenario like that, I would recommend that we put a full coverage crown over top, whether that be in metal or in porcelain, and that will help to increase the strength of the tooth and give that tooth a longer lifespan. Another scenario where I would recommend a crown is a root canal tooth. So with a root canal tooth, because the tooth is essentially dead in that the nerve has been taken out of the tooth and it's been filled with a filling material, over time, that tooth will become weak and more susceptible to fracturing. In a case like that, I would recommend going ahead and putting a full coverage crown over top of it again. And again, that will help to increase the lifespan of the tooth and prevent further wear and fracturing of the tooth. So those are scenarios. That was the second scenario. The third scenario that I would recommend a crown would be a fracture in the tooth. So if you are a heavy clencher or grinder, symptoms that a cracked tooth has happened is if you have sensitivity to biting, especially when you're eating hard and crunchy foods. Those are typical signs of a fractured tooth. And in that case, I would also recommend going ahead and putting a crown on the tooth that is symptomatic. So those are all scenarios where a crown is going to be helpful and beneficial for your tooth long term. More information can be found on this brochure on our website at www.centennialsmiles.ca, and it gives you some great information on what veneers are, what crowns are, when they can be used, and a lot of good information there. If you do have any questions, however, please feel free to call us at 587-353-5060. Thank you, and until next time, stay safe.